pregnancy is all about excitement, nerves, and lots of hormones that bring about various symptoms. It's exciting, but can also be full of new to you feelings. You might start to feel things that resemble PMS symptoms, such as fatigue, headaches, sore breasts, cramping, frequent urination, extra gas or bloating. Then there's the dreaded morning sickness that many pregnant folks experience early on. But all of these not-so-fun symptoms mean that your body is producing the right hormones at the right time to start supporting the development of your beautiful baby. Let's talk about all that's happening to you at 6 weeks pregnant. You might have PMS symptoms like fatigue, sore breasts, and headaches. You may experience morning sickness. Your baby is still teeny tiny, about the size of a grain of rice or a pomegranate seed. The baby looks something like a tadpole, with a small tail that will become a spinal column. Your baby is growing their brain and spinal cord, and their heart is beginning to beat. Tiny buds are on their way to becoming arms, legs, and ears. The brain, lungs, and other organs are developing, too. Although it's too early to see if baby has Aunt Ella's nose, what will become facial features are unfolding. Baby's heartbeat can often be detected by vaginal ultrasound at this stage of pregnancy. Changes in your body at week 6. By week 6 of your pregnancy, hormones are in overdrive, causing all of those symptoms we mentioned. Although people can't see that you're pregnant yet, your uterus is growing. It may press on your bladder and send you rushing to the bathroom more often. Increased blood flow to your kidneys also contributes to more frequent urination. Twin development at week 6. More babies can mean more fun. But you have a higher risk of developing certain pregnancy complications if you're carrying multiple babies. Here are the most common complications you may want to discuss with your doctor. Anemia, preeclampsia, gestational diabetes, vaginal bleeding, cholestasis of pregnancy, twin-to-twin transfusion syndrome, which occurs when one baby gets more blood than the other baby, preterm labor, intrauterine growth restriction, or delayed fetal growth. If you're diagnosed with a twin pregnancy or more, your course of treatment may change slightly. You may need more frequent checkups, face certain restrictions, or even plan an earlier birth via cesarean, if your healthcare team deems it necessary. People who are pregnant with twins typically gain more weight. You also usually need more nutrients than if you were just carrying one baby, including folic acid, calcium, iron, protein. 6 weeks pregnant symptoms. Some symptoms for being 6 weeks pregnant include morning sickness, frequent urination, fatigue, swollen or sore breasts, feeling emotional or irritable. Here's more about how to manage these symptoms so you can focus on prepping for a baby on board. Morning sickness is common. About 70 to 80% of pregnant people experience nausea and vomiting at some point in their pregnancy. The cause of morning sickness is not fully understood, but an increase in the hormone human chorionic gonadotropin is believed to play a role. Most people feel better by the second trimester. Talk to your healthcare providers if your nausea or vomiting feels unusually extreme to rule out hyperemesis gravidarum, which causes severe nausea and vomiting during pregnancy. What you can do to feel better with morning sickness. Eat small meals several times a day. Keep foods you tolerate well at hand to nibble on. Many women swear by eating saltine crackers before getting out of bed in the morning. Avoid spicy or greasy foods. A bland diet tends to go down easier. Don't lie down right after eating. Try to avoid odors that trigger nausea. Drink plenty of fluids, especially if you've been vomiting. Ask your doctor if you can take ginger capsules or ginger tea, which may bring relief. You may find your nausea temporarily alleviated by tart or sour foods and beverages. Fatigue. Feeling run down? The fatigue you're likely experiencing is normal. It's caused by pregnancy hormones and increased blood volume. Taking it easier may have to become a part of your routine. What you can do to help alleviate fatigue. Take naps. This can prove challenging if you're working or caring for other children, but finding time for a catnap during the day can help combat fatigue. Go to bed earlier. Drink more fluids earlier in the day, so you don't have to get up as often at night. Let others take over some of the chores, if possible. Skip caffeine and rely on staying hydrated and grabbing some high-quality energy from fruit. Constipation. Prenatal vitamins are often vital to the health of you and your baby, but all that iron can make you constipated. What you can do to alleviate constipation: drink plenty of fluids. The Institute of Medicine recommends that pregnant people drink 10 cups of fluid each day. Tip: if your urine is dark yellow, you may be dehydrated. Increase your fiber consumption by eating lots of fruit, vegetables, whole grain breads and cereals, beans, nuts, and bran. Exercise is good for the body and mind, but also helps prevent constipation. Don't be tempted to take laxatives before talking with your doctor. Things to do this week for a healthy pregnancy. 1. Schedule a prenatal appointment with your doctor or midwife. Prenatal care is important for you and your baby to make sure any issues are treated quickly. Some doctors like to see you when you're about 6 weeks pregnant. Others prefer to wait until you reach 8 weeks or even later. 2. Take your multivitamins. If you haven't already started taking a prenatal vitamin, ideally, you should begin taking them in the year before you conceive. You should start taking one this week. At your first prenatal appointment, your doctor will prescribe a supplement containing extra vitamins and minerals that you and your baby will need throughout pregnancy. If you won't see your doctor for a couple of weeks from now, you can call the office, ask for a prescription or their over-the-counter recommendation. 3. Don't smoke. Smoking increases your risk for miscarriage and other complications of pregnancy. It also increases your baby's risk for health problems and low birth weight. 4. Drinking can cause fetal alcohol spectrum disorder, FASD. Although symptoms vary, in its most extreme form, FAD may cause abnormal facial features, learning disabilities, and other health problems. There's no safe amount trusted source of alcohol to drink while pregnant. 5. Skip the hot tub and sauna. Hot tubs and saunas can increase your risk for miscarriage and fetal abnormalities. As a rule of thumb, avoid activities that elevate your body temperature above 101 degrees Fahrenheit, 38.3 degrees Celsius. 6. Eat well. It's important to eat nutritious meals throughout your pregnancy. If you're experiencing morning sickness, eat the foods that sound good to you and that don't make you sick. 7. Drink plenty of water. Now that you're pregnant, it's extra important to keep up that hydration. Drink at least 8 to 12 glasses of water a day. Dehydration can lead to serious pregnancy complications. 8. Take it easy. Though it's important to continue with low-impact exercise, you also need to take it easy when you're tired. Your body is working extra hard to prepare and grow your little one, and it needs time to recharge. Your first prenatal appointment. Although every healthcare team approaches care a little differently, most include the following steps in an initial prenatal visit. Staff will review your medical history, including medical conditions and surgeries you've had, and current prescription and over-the-counter medications. Your weight, heart rate, and blood pressure will be checked. Your doctor will order routine blood tests and ask for a urine sample. During your pelvic exam, your doctor will examine your vagina, uterus, pelvis, fallopian tubes, and ovaries. You'll be given information about what to expect during your pregnancy and instructions for a safe, healthy pregnancy and baby. You'll have time to ask questions, so brainstorm all the things you want to know. When to call the doctor. A lot of what you're feeling is totally normal and nothing to worry about. But call your doctor immediately if you have any of the following symptoms: vaginal bleeding, fluid leaking from the vagina, severe abdominal or pelvic pain, fever, blurred vision, severe headache, severe or sudden swelling of the hands, face, or fingers, pain or burning when urinating. That has been Pregnancy Week 6. If you got any value from this video, hit the subscribe button. Subscribe to the channel and don't ever forget, you know how to mom.